Well, thank you for having me, and this is the non-economist part of our session. So, my background is I was actually trained as a quantitative psychologist, and at the Prevention Research Center, we became interested in this area because it was just first of all the idea of being able to have another way of talking about the importance of an intervention, but also making a case for wider implementation of our interventions was a very appealing thing when it came to program evaluation in general. And then also just thinking about the efficiency of program delivery, trying to figure that type of, the best way to look at that, the best way to make delivery of services efficient. I work with Max at Penn State and Mark Greenberg, who unfortunately couldn't be here today, got a temporary health setback. It's something that we've kind of learned as we've gone, but we've followed a lot of what, whenever I talk about this in general, a lot of times I'm presenting what Steve is doing, so it's kind of, this is one time when I don't need to do that when I'm in the same session with him. But, what I want to talk about a little bit more in contrast to what Steve covered is going to get a little bit more into the idea of measurement, how we measure, thinking about the best ways to measure economic outcomes, but also what might be left out at this point. And where we might go with our research. So, thinking about this kind of from a prevention scientist angle, I think when we first got into this, when we're thinking about programs for children, youth, and families, what we noticed at first, we simply noticed what the typical outcome categories were. And this is just similar to what Steve had up before. We noticed that everything was involving criminal justice system, education, employment, substance use, kind of the classic outcomes that you see in economic evaluation. We know the well-known studies that demonstrate effects, the ones we've seen. The headline is always how much total return the program does or will generate in economic benefits. But, the thing that became aware to us when we first looked into this was what was hidden behind the headline. Is it based mostly on one sector? Does it involve a combination of many sectors? Who are these economic benefits going toward? Benefiting whom? Participants, taxpayers, other non-participants? And when does this savings or benefit occur? Does it occur currently? Is it based on projections? These are a lot of things that we needed to understand as prevention researchers when we were first looking at this. But when you look at the classic programs that we've all talked about, we're all familiar with here, Perry Preschool Project, these are just a few of examples of the outcomes that are monetized in these studies. But, it's a lot of the same type of stuff. Lower crime rates, less retention, less special education use. Arthur Reynolds' study on the Chicago Child Parent Centers had a study come out a couple of years ago showing a 10-to-1 return on investment. This was based on increased earnings, tax revenues, reduced costs associated with crime, et cetera. We've talked about the abecedarian benefits. Then looking more at the prevention programs, Margaret's study with Communities of Care, showing the benefits that came from decreased smoking-related costs, reduced delinquency, Seattle Social Development Project, and life skills training were other prevention programs that showed return on investments. So for us as prevention researchers, it's just trying to figure out if we could understand how these outcomes were monetized. It involves a lot of kind of fuzzy math, but typically involves current directly monetized outcomes, or it can involve a lot of projection of outcomes. And we also learned the importance of the shadow price. The shadow price is just something that wasn't obvious to us at the time, but we realized how vital shadow price methodology is to prevention research when it comes to trying to evaluate the return on investment. And common shadow prices, of course, we're familiar with, such as high school graduation, achievement test scores, shadow price for criminal acts and early substance use. We realized that shadow prices were harder to determine for outcomes measured at younger ages, that it helps to have some sort of categorical result a lot of times with shadow prices, And certainly the more projection involved to determine the price, the more uncertainty that we have to factor in with our methodology. So, and just starting off talking about standards, I think the thing we realize is that really there are no standards when it comes to valuing benefits, especially with preventive interventions in the behavioral sciences. Going beyond the idea of monetization of outcomes, we have a wide variation in the approach of the analysis that in economic evaluation, what measures are included, how the outcomes are valued, also with the structure of the assessment in terms of the time and the reach of effects. I think this is another thing we don't think about a lot. We don't talk right from the outset kind of what the scope of our research is going to be. But we do realize that methods are much more consistent when it comes to valuing direct effects. So thinking about how to monetize, sometimes it's kind of a matter of thinking about, is the focus of our evaluation on determining how to value key study outcomes that may be indirectly linked to dollar amounts? Or is the focus more on how well an effective program impacts true economic outcomes, and we put more efforts toward those? Of course, the answers are going to be really largely influenced by the nature of the program, the age of the participants, the outcomes that are targeted. But it's another question we think about in terms of standards. The studies of the economic benefits for programs, are very important, but they vary widely in the way that the outcomes are monetized. A big factor here is that so many of the outcomes are left out, partly because of the lack of precedence for how to monetize these outcomes. The ones that we're used to in our field, mental health outcomes are not always easy to monetize unless there's a lot of use of services. Social skills and competence, early child behavior, and parenting skills are common outcomes that we just don't have enough precedence for how to monetize. And there's also a lot of variation in how much effects are projected into the future. So I put this tree up here because a lot of times I think of when it comes to selecting measures for an economic evaluation, the outcomes are selected very differently across studies. Sometimes we're focused on kind of just getting the low-hanging fruit in an economic evaluation. If we go for something that's more difficult, something higher on the tree, we end up with a lot more potential for error in our estimates. At the same time, it's important that we consider the full set of possible outcomes in these evaluations in order to achieve adequate coverage and come up with the most comprehensive results in an economic evaluation. So a lot of this comes down to thinking about what's left out in our evaluation. When our interventions are evaluated for economic impact retrospectively, it comes down to an issue of planning. The lack of planned measures can lead to an incomplete assessment of benefits. But it also could be a matter of just the inability to capture costs within a set of measured outcomes. This is something we need to think about when we're planning economic evaluation and prevention. So what may be vastly underestimated is the value of the factors that might be linked to long-term personal success, including things like development of interpersonal and interpersonal skills. I think the complexity of the interrelationships among these different factors, for instance, cognitive and non-cognitive skills, as well as the context for the way these factors interact, is not usually easily represented in the assessment of economic benefits. So we may recognize the importance of certain skills for long-term personal success, but the challenge is determining how we capture these skills in measurable outcomes that aren't currently included. Typically, we're used to what we see, in the first slide and what Steve showed in his slides. It's not always clear what ages we should be measuring for some of these skills. It's not always clear how we sort out the unique contribution of various skills. And the approach can build on prior research establishing precedents, but there's not likely to be any standard methodology for handling these more complex associations at this point. So I thought about kind of just off the bat, just thinking about standards for measurement when it comes to valuing outcomes. And as prevention researchers, I think a first step is really to plan ahead. As we talked about with the evaluation of costs, we want to consider the economic evaluation component before we establish plans for the overall program evaluation. And I think a big part of this is consulting with economists who can guide us, who can provide us with expertise for how we need to structure our evaluation, including assessment of cost in there. I think within the preparation of this proposal, we want to check prior research for what's been done in the particular area with that population within the same context, and certainly check what standards have been established for economic evaluation, especially regarding measurement for the sake of monetizing. The second step is considering the scope and the reach of the program effects. What outcome domains do we think will be affected? How far over time do we think these effects will extend? And who will be affected? This gets into the whole idea of kind of a logic model of our intervention. Is it the participants, non-participants associated with participants, non-participants not associated, such as taxpayers? And in what ways might the intervention lead to increased costs while also potentially generating an economic benefit, as Lynn pointed out before? A lot of times our interventions may lead to temporary increasing of cost in the program. The third step is to determine the best measures for economic evaluation just based on the intervention logic model. So which of these outcomes will be measurable within the plan, program evaluation, and follow-up periods, but also which sources of potential program benefits will we not feasibly be able to measure? It's important to map all of these things out. Which measures for certain outcome domains have been used in prior research? Is there anything that we can base our approach on? And which of these outcomes are going to rely on projecting in our models? Finally, how are we going to represent this uncertainty in valuations, especially where projections are involved? A fourth step in this process is to assess kind of what key program outcomes cannot be valued. Should the evaluation incorporate other methodologies, such as contingent valuation, for these outcomes to determine economic benefits? If the outcome is a primary variable in the program evaluation, should we incorporate a cost-effectiveness component to it? Still, certainly may be a very important outcome, even if we're not able to monetize it. And what current or future research may help determine the possible valuation of these outcomes that we might be able to incorporate later into retrospective economic assessments? So thinking about kind of, I just wanted to put up a kind of hypothetical program here, just to think about how we might map out the outcomes that would be included. So for instance, we have a middle school program aimed at improving social skills and decreasing substance use in adolescents. And it involves components such as a demonstrative video model, so you can see the kind of stuff we have in the intervention there. And the pilot study indicates some very strong effects from this program. Fewer class disruptions, lower rates of bullying, increased engagement. In subsequent research, the evaluators want to include an assessment of economic impact. So they plan to assess the full cost and resources necessary to deliver the program. They also plan to follow the participants in high school grades. And prior research shows common methods for valuing the outcomes in these school programs to help them determine what measures to include for this age grade. So classic things that we're used to monetizing, like use of special education services, class grades, grade retention, substance use. So for the middle school program, the participants in this case can provide outcomes that are more readily monetized. We have a better sense of academic achievement at these ages. We can measure substance use at these ages. We can measure delinquency and early justice system involvement. So it tends to be a population that we can tap into with economic evaluation a little bit more than some populations. but there are still several choices. How much do we only value outcomes such as those listed above, some of which involve direct cost? How much can we project costs from effects on current outcomes? Reduced early substance use projecting the longer-term problems? Improved academic achievement to future earnings? Should we consider the value of outcomes that are not easily monetized? If we follow them into young adulthood, do we now want to assess things like whether they completed high school, college experience, early employment experience, longer-term substance use patterns, longer-term delinquency and criminal activity? And we also might want to assess whether the evaluators could, whether we want to assess teacher outcomes or other school-based outcomes. Are there other family members that are affected here? So it's really important to consider the logic model. But you can see what we can do when we think about the potential measures is we can build up this table that shows both potentially monetized outcomes as well as non-monetized outcomes. Thinking about the possible short-term proximal effects on the top of the table here, we can see that we've got the potential for this program to impact many different aspects of economic success. And down at the bottom, we see that we can consider the possible long-term distal effects, too, on students, on family, on society. This is the kind of thing that we need to map out from the beginning with our logic model to understand the potential outcomes that we might value, but also the potential outcomes that are non-monetized, but that have value for our economic assessment. And I want to switch gears a little bit and consider programs for younger children. My feeling is that certain programs are at a disadvantage for economic evaluation just based on the nature of the process involved here. We do not usually have the ability to follow children much beyond the time frame of program delivery. Obviously, outcomes measured at young ages are not readily monetized usually. And intervention effects that are linked to future costs are typically subject to downweighting, discounting, fade out, et cetera. But at the same time, we're all very aware of the fact that lasting effects might rely on delivering services to children during key developmental periods. In other words, at the right early time frame for children. Much research has demonstrated the importance of early intervention, including developmental cascades research, preschool intervention, the important research by the Heckman Group on skill formation for long-term personal success. So I think our challenge here is how we value outcomes when the process may be complex, involving multiple dynamic interactive factors, and not something that's easily represented by measures that we typically have in our studies. So to use a term that's not very popular among many of us, we think about these non-cognitive factors and the importance of including them when in an economic evaluation when we're assessing programs for children. There's a lot of good research that's now looking into the mechanisms by which these non-cognitive factors and things like the big five personality factors influence long-term success. Ideally, this research will help us understand both how these factors collectively influence adult outcomes, but also how we can best measure them in economic evaluations. Research indicates that the non-cognitive factors are even something that might be more malleable and more something that we can intervene with for children that are older ages. So it might be something that's more of a better target for intervention. The role of non-cognitive skills in long-term success is not currently represented in economic evaluation of programs for children. This is kind of an example from the Heckman Group that shows how we might be able to model these more complicated associations, where we incorporate both capabilities, investments, whether it's intervention or from parents, along with the context at the same time to understand how people can develop the type of skills that lead to long-term personal success and in human capital. So I feel like the research that people will do will help broaden the field and help enable us to incorporate these type of associations more into future research. When we do this type of research, like Steve talked about, it needs to be based on a robust methodology, multiple studies. It should involve causal associations in order to understand truly how these early skills influence long-term success and economic outcomes. And once these links are determined, there should be consensus to what the appropriate measures are that will best represent these skills. And certainly the folks at WISIP are already undertaking this type of research with Steve's new models, incorporating things like early mental health and behavioral outcomes and how they link to future costs. I think this research will be important to look at, certain domains such as aggression, early aggression, and early social skills to be able to understand the association between long-term economic outcomes. And if there are certain areas that tend to be have stronger associations, this is the type of thing that we would prioritize for first developing shadow prices. Certainly in this research, we want to factor in how much these traits might fluctuate over time, the likelihood that they might change as the gap between the skill and the economic outcome is increased. And we need to factor in different contexts in understanding these associations, as well as different characteristics from different populations. We might think of these variable associations as represented in terms of likelihood for later states to occur. For instance, an improved mental health outcome influences the likelihood of something that we have a better shadow price linked to, such as high school completion. Around this likelihood, we also should understand the potential variation in the causal influence. So ranges are good, like we've been talking about. I know somebody mentioned that policymakers don't like ranges, but it's something to factor into the overall sensitivity analysis of the economic evaluation. We need to understand that we can bring these important causal associations, these important links between early skills and future adult outcomes into our research. And currently at our center, we're doing this type of research. We're focusing on trying to understand the links between these early outcomes, typically measured in program evaluations for things like social emotional learning programs and future adult outcomes, trying to understand, make the link between the measures that we see in these program evaluations with the typical adult outcomes that we see in economic evaluation. So the future is bright. Economic evaluation for family, child, and youth programs is only going to get better in the coming years, thanks to this research. But I think we need to have standards and consistent methodology in order to compare everything across studies. Like Steve's saying, the closer we get to apples, the better this research is going to be able to make the best conclusions about economic value of our programs. We also must be able to fully consider the possible impact of effective programs. Incomplete assessment is inadequate. And I think that's kind of what we see the most with economic evaluation and prevention. We see too much where people are just using what's convenient, what measures they happen to have. That's been great, because if it shows a positive return on investment, then that's still an important finding. But we need to be able to assess all of the areas that the intervention is supposed to reach, including whether it's other family members, other people associated with the program implementation. But also some collective organization of determining and promoting appropriate methods and measures would really help researchers in the future, which is why this workshop is so important. Thank you very much.